Have you been having problems with ankle pain or foot pain, or have you been worried about prevention of injuries of ankle or foot pain? If so, then this video series is for you. My name is Biagio Mazza. I'm a physical therapist with Elite Physical Therapy, and today we're going to talk about something to provide you with some value to help give you some information about ankle or foot issues that you may be interested in. One question that I get a lot is the difference between, or the reason for why when somebody rolls their ankle, would you have an ankle sprain versus a fracture? And the most common reason for a sprain is called an inversion sprain. We talked about that in a previous video, where the ankle will kind of roll in. And when it rolls in, it comes down, it puts a bunch of stress on the ligaments from this position here, and you typically get either ankle ligament stress or tears. It doesn't typically tear the bone unless you're a younger athlete. Young athletes, as a matter of fact, my son, who's 12 years old, has fractured this part of his bone several times for the same type of motion. But kids, they have a little more pliable ligamentous structure and their bones are not quite as hard as adults. But for adults, typically you roll your ankle in, you're going to get a irritation or tear to the ligament. On the other hand, if your ankle goes the other direction, if your ankle goes out in that position there, you can get an eversion sprain of the ligaments, but very often that's where you get a fracture. You can get a fracture of the tibia, the bone, the kind of the bigger bone in the middle there. You can get a fracture of the talus, which is a bone in there. You can get a fracture of the heel bone, the calcaneus, in that position there. That's typically the difference when you hear kind of a mechanism or a cause of injury for a fracture, of why a fracture would occur over a ligament strain or sprain. Hopefully you found today's information helpful and learned a little bit about foot and ankle issues, or how to prevent foot and ankle issues in the future for you. If you are interested in learning a little bit more about your body specifically, you can contact the office and ask to do a free consult with me. In that free consult, what we would do is go through kind of a mini exam and see what successful treatment might look like for you, or successful prevention might look like for you. If you're interested in doing that, give the office a call and just tell them I want to set up a free 30-minute consult with Biagio, and they'll know how to get you set up and to see me.